This is rose ointment, and I've added some essential oils, and we're going to show you how to do facial reflexology or acupressure facelift, whichever you want to call it. And I don't have any makeup on, so I'm going to take a little bit of this and I'm going to dot it into places that have a few wrinkles. So there you go. And then I'm going to start, spreading it around. Please avoid your eyes, because I do have essential oils in here and we don't put those in our eyes. There's only a few that are safe to even put in the ears. It's not like you can't put them in your body, it's just you have to be careful. And then if you need a little bit extra lotion, this is the lavender. It's a Young Living product, just like the rose ointment is. And it's a very thick lotion, so if you don't like this lotion, then use something thinner. I use Natural Formulations has beautiful organic lotions. Please make sure they're organic, because they're going on your skin. Always work from the midline. And our brain in reflexology is up here on the forehead. And then the spine comes down, and then the organs. So when you see things going on with the lips, like in the morning I might have a swollen lip. That means that my colon, in that area, the upper colon, which you call the transverse colon, there's something going on there. It's every day. That's just something I deal with. And we're going to work all the way down to the clavicle. So the lymphatics drain here through the center of the chest. What we're going to do is go down across the clavicle and include your décolleté, because the platysmus is this big muscle, huge muscle like this, going from the chin to the clavicle. So we want to make sure we get that whole muscle, because it does affect the face. And if this is toned, the facial muscles will be toned, and we want to work the forehead, this frontal muscle here. There's not a lot of muscle on top of the head, but we're going to work a little bit, especially when you're giving. It's easier to work the head. It certainly does feel good when you're receiving, doesn't it? So work the ears as well. Okay, so now when we spread this on, I'm going to show you how to spread the lotion and how to do the lotion application as you're massaging. So this is just your massage first. So we've got it all over. We're working away from the center line and down. And then we're going to start with circular motions. And this is what we call the sternocleidomastoid. You can actually see that muscle right there. That's the clavicular attachment. Then there's a little bitty attachment here that goes over just to the outside of it, lateral to it. And there's a little notch there. So you can see that. See, my finger just kind of sinks in. So we're going to work this. This will keep the side of your face from drooping, and it'll tone the platysmus, which is the surface muscle. So we're going to work this in circular motions as many times as you like, but definitely cover that whole thing so you can see how the circles overlap. And then we're going to work the clavicle. This is pulling the lymphatics from the back to the front, all across the clavicle. Then we're going to work the other side. So sometimes we'll work one side at a time, and then other times we'll work both sides. It just feels better that way. So if you're receiving, then you're going to get the energy from the person giving. And you can relax. But okay, I don't know if you can start seeing there's redness happening here. So I'm getting some blood. And that's the main reason why we do these self-massages and stuff, is to get that redness. It's really nice and red now. And that's going to help tone everything. We need oxygen to the tissues. We need to bring that oxygen through the bloodstream into the tissues. I have a whole body brushing routine, but I can't do it because I do it naked. And I want to show you that body brushing routine in another video. Okay, so now for the face, we're going to secure the skin next to the ear, and we're going to pull away. This is a myofascial technique, and we're not going deep. This is still just kind of superficial. Go as hard as you can, though. It feels good. It's not hurting, but we're working on the fascia of the chin and the jowl line there. So we're going to hold it and pull towards the chin. Got it? Okay, and then we're going to go across the face and around. And really try to keep your lips. I can't do it with my mouth closed, but anyway. Yeah, there you go. And then across the upper, try to flatten. This is the what we call the apprehension of the hand. It's what part of the hand is touching the skin. The apprehension is the area of the skin. It could be of the hand. So the area of the hand could be one finger, all fingers, inside the fingers, between them, could be the palm. You know, we could grip things. But so the apprehensions in massage, we call that what surface of the hand is actually touching the body. And we want to get as much of the flatness of the fingers or even the whole palm. So I'll show you. Here's the flat fingers and here's the palm. But see, I'm not just letting go. I'm actually holding my mouth with lips together or fingers. Okay, and then across the forehead. Now I'm not going really close to the eye because I told you we're not going to put essential oils in our eye, but I will show you how to use the acupressure points later. Okay, so across the eyebrows. I love the eyebrows. Oh my gosh. They're so tender. I don't know why. And we're just going to make lines all the way across the forehead as we come up and across. And do that again. So the eyebrows, above that again. I'm just kind of using fingertips. Good. And then the ear. There are muscles around the ear, behind the ear, and then we also have the masseter right here. So we're going to work behind the ear, and we can do that at the same time on both sides. And then we're going to take our ear and actually pull it back, not out, but back and kind of at a diagonal. So we pull it up and back, and straight back, and then down. And you can make that one swoop across the ears. Really feels good. And if you want to work inside the ears a little bit, won't hurt to have this on the skin. That's fine. Okay, now we've done a lot for our face. Let's do our eyes. So you go gently across the eyebrows and down, and just to the nose, and then we're going to do the nose. So around and just to the nose, and then work this. You know, the nose never stops growing, and we get these little creases from sleeping. See how, I don't know if you can see the redness. If I get closer, you can see how red it's getting. That's so nice because we're getting that blood supply. All right, so acupressure facelift follows the facial massage. I do this every morning. Not every single day, but a lot of the days of the week. So we're going to start with little presses. These presses are touching, pressing to the bone until you can't press anymore, and then little circles. And then we don't not touch the skin. We just slide over the skin. So you lift up a little bit, so you're not just touching. Slide over and do it again, little circles. So we've got these lines. We're going to go on the bottom, which is actually on the teeth. So it's on the lower jaw, and it goes across all the way to the ear lobe. Then the next line is a top, and that's on the top teeth, but below the cheekbone. And that line goes all the way across to the ear. About the same place, excuse me. And then from the nose, the bridge of the nose, these are the little wings of the nose, we're going to go over the bridge, so the cheekbone to the top of the ear. See that? So if we were to take a pencil, you could see the lines. Okay? So we do these little presses. I don't care if they're clockwise or counterclockwise, it's not important. The idea is to get the presses in. Working on top of the teeth, but below the cheekbones. See that? And then over to the ear again. And then from the bridge of the nose, you can feel the flatness right there. And then it starts to get round. And then to the top of the ears. Then we're just going to do really light presses on the orbits of the eye. Kind of on the bone though. The orbit is quite large. The eyeball sits in it. So we're still just working the skin. And then with our thumbs right underneath the eyebrows, we press up. This is a duct, the lacrimal duct that helps the tearing. So it's good to give it a massage, and sometimes they're sore. Then we're just going to pinch the eyebrows just gently. Never ever pinch to where it makes you tired or it causes bruising. Gotcha? Okay. And then again the lines across the face. Okay. Now here's the creme de la creme. When you work on the platysma and the attachment on the jaw, I mean, this is like the only attachment of the neck muscles on the face, and the face muscles attached. There's not a lot of bony attachment. We could actually take this face and just lift it off the bone. There's not a lot of bony attachments on the face for these muscles. So what we want to do is tone that. So we're going to start back here. There's a vertical bone, a vertical surface on the jawbone. We call that the ramus. It means it's behind the bone. So this ramus is our first point, and we're going to press. Then we're going to try to go underneath the jaw muscle. So I'm actually trying to go on the surface. So if this is the bone, and this is the outside of the face, I'm pressing into the bone from underneath and inside. A lot of people, you won't be able to touch this. They are too tight, they have too much fatty tissue, their muscles are just too tight. But if you can, you will be amazed at how beautiful this neck will become. And you can do this sitting in your car at a traffic light, talking to somebody on the phone, sitting at your computer. Start at the ramus again, and then press underneath. And if you're doing this as a therapy for someone, don't do it at the same time, because the tongue is here and you go, you know, you'll push the tongue into the throat and they'll gag. So just do one side at a time. So what I like to do is start at the ramus when I'm giving. Ooh, that's so sore. Feels good though. And then I'm going to go left and right, left and right, left and right. So I'm alternating sides, and I'm going slow, and I'm pressing on the underside of the jaw. That's beautiful. Oh, it feels good too. Good. Okay. So do that every day. I have gotten older. I don't have all those really deep wrinkles here. I do have a little loose skin. That's a lymphatic problem I'm working on. But now I can dry off a little bit and then just go ahead and apply my makeup. So I'm ready for the day. Thank you very much. I'm Dr. Winona Wellspring, and this is Facial Reflexology. Bye for now.